The aged care sector is simply not sustainable under its current funding levels. That's the evidence that's been presented to the Royal Commission this week. With demand for care set to skyrocket over the coming years, the Treasury has called for older Australians to contribute more to their own care. Speaking today, former Treasurer Peter Costello says he agrees, but that the income and assets tests need to be simplified.
I have attempted to fill in these income and assets. You all ought to do them. You know, the Royal Commissioners ought to do them. You know, I think there are over 100 questions and 27 pages. And, you know, I think I'm reasonably financially literate. I had a lot of trouble filling it in. I don't know how a person going into a nursing home would ever be able to fill it in. We're talking about people who might be 80 or 90 years of age. How do they do this? I mean, my suspicion is a lot of them just don't.
On Monday, we asked where the billions put into aged care every year actually go. The answer, surprisingly, no one really knows. What we do know is where it needs to go. Care providers across the country have sounded the alarm over an acute shortage of workers, just as the country needs them more than ever before. Stephanie Bolci has more.
The number of people over the age of 85 is expected to double by 2042, and the people who look after us in old age are ageing themselves.
I don't think we've done enough work to encourage workers and new entrants into those sectors so that they can understand that this is going to be a viable career going forward.
And even before coronavirus exposed the very real and deadly issues of staff shortages in aged care, the government said we would need more than 250,000 people to enter the healthcare and social assistance sector by 2024. Back in 2019, it was projected to be the largest slice of employment growth in the country. But disability activist and ACCOS policy manager Craig Wallace says demand alone won't work.
We've got a degree of market failure here, and it's been driven by things like historic underpayment of what is a highly feminised workforce.
Advocates have been raising the alarms for years that there's a systemic and social issue.
You can be paid more as a retail worker in Big W than you can as a personal care assistant in an aged care home. We don't value sufficiently the people who work there, and therefore it doesn't attract people.
Research from the University of Wollongong found more than half of nursing homes in Australia had unacceptable staffing levels using the US rating system, getting only 1 or 2 stars out of 5.
There's no requirement for aged care homes to have qualified staff.
As more people lost their jobs during the pandemic, the government announced a number of schemes to get people back into one, to reskill into others, and to keep certain sectors working away. From JobKeeper, JobMaker, Home Builder to Job Trainer.
Today's announcement on these skills supports are about looking forward to the jobs into the future and to ensure Australians can make the choices they need to get into those jobs by getting the training they need right now.
But the Australian Institute's analysis found stimulus policies by the government have disproportionately benefited men.
One of the things that I've been arguing in a number of places is that alongside the construction industry and IT, we need to understand the economic value of the community services sector to Australia. Caring in an ageing population in the midst of a disability services revolution is actually a real opportunity for the Australian economy.
For more on this, we're joined in Canberra by Chief Economist of progressive think tank, the Australia Institute, Richard Dennis. Good evening to you, Richard.
Good evening.
I've got a question for you here. Let me just find it. Just talk amongst yourselves. Oh yes, here it is. It's quite good. How is it, Richard, that we have 1 million people unemployed, but we can't find enough workers in aged care? You can't find enough people to deliver like cleaning services and gardening services as part of the Commonwealth Home Support Package for elders, and you can't find enough disability support workers. How is that possible?
Because we have decades of spectacular policy failure. I mean, obviously right now in the midst of this crisis, we have far more than 1 million people looking for work, and we have a Royal Commission saying there's an enormous amount of work that needs doing. If only there was a solution. Well, of course there's a solution. Governments have been spending tens of billions of dollars per year on aged care for decades, and the quality of the aged care is declining, not increasing. So it's quite simple. The model that we've created in recent decades isn't working. Step one, we need to admit that. And then step two, we just need to ask, what is it we want to get out of aged care? Now, it's interesting, no one uses the term nursing home anymore because there's no nurses there anymore. We used to call them nursing homes because they had nurses in them. We now have aged care homes that often have no trained nurses on site when you have centres full of very old, very sick people. So the model's broken. It's not complicated. We need to spend more money, but we need to spend it differently and create an entirely different set of incentives, because we can't expect young people to chase some of the hardest low-paid work and least secure work in the country. That's not going to happen. We can't expect young people to do that, so we've got to change the policy settings.
Before we get into the details, Samara, you're nodding away. Is there an expectation that young people will just train up in this and train up in that and go from place to place and just meet the gaps in the job market?
Totally. When we're not asking young people as well, like, what do you want to do? You know, aged care is a very unique kind of work, and you have to be kind of open to doing all the personal care, and you know, it comes with a lot of stress, it comes with a lot of emotional torment. You know, I had a friend who used to work in an aged care home here, and she left because it was just emotionally distraught because of having to watch people die after, you know, the next person die. And I think that was a very big struggle for her. And she was a young person, so we kind of just expect, oh, yep, you'll do what you got to do because you need a job, you need to tick a box, when we're kind of going, well, yes, but am I passionate about that? Is that the problem that I want to solve in our society? Rather, you know, we're giving people a box to sit in and fit in, rather than going, okay, let's create it. What is it? How do we do this together? And, you know, aged care, if you're loving, caring person and that's where you want to be, you want to support that cohort to see the end of their life out, and you know, then that's awesome. But if that doesn't fit for you, then, well, you know, put people through some trauma, more mental health problems, more, you know, society stuff. Oh, gee whiz.
Can I ask you, Richard, community services, as we saw in that package, if you're thinking about the jobs of the future, hundreds of thousands of jobs in disability services, in caring services generally, but politicians tend to talk about hard hats and IT and STEM.
Oh, absolutely. I mean, you know, unfortunately the term jobs has been disconnected from economics and inserted into politics. So now when a politician wants to talk about jobs, they need a certain backdrop. They need men with hard hats or people wearing white lab coats, maybe some high vis. But of course 80% of Australians don't work in construction or mining or science. The health industry is the biggest employer in Australia. The health industry is the biggest employer in Australia. Far more people work in retail and hospitality than work in mining or indeed in manufacturing. But you'll very rarely see a politician show up at an aged care home to make an announcement about jobs. So we've got this very blokey notion of what a real job is, and that very blokey notion of a real job literally gets in the way of us having a meaningful public debate about how do we best create hundreds of thousands of jobs for unemployed Australians. We need to stop saying silly things like, if we build a road, we create jobs. Of course, if you build a road, we create jobs. We need to start to have a conversation that said, if I was going to spend $1 billion on something, which something would create the most jobs? And there's no doubt that aged care, healthcare, education, those are the sectors per $1 billion that create far more jobs.
And in fact, you've done some research on this. We have it here. You looked at how far $1 million of government investment goes when it comes to creating new jobs. So $1 million creates less than one job in the energy and water sectors and 1.2 jobs in construction. But in health and social assistance, $1 million creates more than 10 jobs, and in education it creates almost 15. Bruce Bilson, is part of the issue here that we kind of haven't done workforce planning in this country? We've planned what sort of skilled migrants we want to have into the country. If everybody wanted to go and be a dentist or a dental assistant, they wouldn't be able to do that in our university system. But we don't have a clear set of plans for how to meet the needs, the demand for positions in the economy.
Yeah, there's been a real awakening that the whole skills thing just hasn't been going right. And Ellen, you'd probably be aware.
But is that surprising if you don't plan it? If you just think,
no,
oh, well,
right.
I'm sure it'll take care of itself. Yeah. The invisible hand will come along and she'll be apples.
Yeah, and it kind of assumes that people will find their way into where the opportunities are. But the observation, very crisp observation that, for instance, aged care is not for everybody is absolutely right. What are the aspirations people have? And without on the aged care one, also what of those in care? What are their aspirations? But coming to your broader point, a few years ago there was the Joyce review, not the Barnaby we're used to, but the Minister Joyce from New Zealand came over and had a look at the skills and training pathway in Australia and said, gee, this isn't joined up very well and your market intelligence isn't very good. And how do you actually see gaps in the labour market and career opportunities and then join them up with education and training institutions so people are tooled up to take up those opportunities?
We used to know how to do that, Bruce, didn't we?
Yeah, look, it's moved over time. I mean,
yes.
I actually think there's something that's shifted, and that is expectation about whose job it is. I mean, in a lot of businesses, I would have thought business leadership is to make sure you've got the workforce, the talent, the people to drive the future. But often now people look to government and saying, well, why aren't you giving me the skills that I need? So I actually think there's plenty of opportunity for improvement to go around, whether it's on the employer side, whether it's on the training and education side. Dennis is right. Richard's right. Some of the incentives are a little bit perverse as well. And we still end up with these huge skills gaps, which you'd think in an economy where there's a scarcity, the price of that labour, that skill would go up, but that doesn't always happen either. So it's all a little muddled, but I think people are realising it's harming our future prospects.
I just think there's an idea too that people are an expense, but an object that you build is an asset. Instead of actually seeing that, the really value that people can bring to a society is just as valuable. I mean, we have a fetish about tradies at the moment. It's an absolute fetish. I'm going to get some beautiful designer to do me some high-vis, beautiful jacket for the Sydney Festival, something. Because it's like...
Then you will have a real job?
Then I'll have a real job.
Yeah.
But, the arts actually employ more people than mining in this country. And just because of the nature of we rely on people to deliver those things rather than machinery and things like that. So for me, I just go, where are our true values? What are we actually leaning towards? And, health, education. When we talk about nurses, we've been talking about devaluing nurses for a very long time. And I take Richard's point. Suddenly nursing homes aren't nursing homes, but they're aged care. And because nurses aren't in there, how are we actually showing our respect to these elders in their final years? How are we doing that? And is money actually the only measure that we can show that?
Priya, do you think that the issue that we're dealing with is stigma so much in terms of caring jobs? Or are we dealing with an issue of low pay, feminised workforce, and that we haven't planned a pipeline of careers for people so that they can see that a career in community services is a career path just like one in retail is?
Look, I think it's a combination of factors, and I think, I think being an aged care worker, this is kind of the example we're using tonight. These workers are completely undervalued, and it basically says to our elderly population how we see them as a society, that we put people in there who are not skilled, trained nurses, who are perhaps not as trained as their counterparts in the hospital system. And it says a lot to aged care workers, saying basically, we don't value you either because you are poorly remunerated and you are forced to work across multiple sites often to make ends meet, and you won't get the training that your nursing counterparts receive in the hospital to do the same things in infection control and care requirements of your residents. These people are dealing with people with really complex care needs, and we just don't, as a society, value them, either how we report about them in the media, how we talk about them, how they're remunerated. I think it's really quite complex. And how do you draw people to these careers? I think we need to start with basically shifting how we talk about them, how we sell them to our younger people, to the younger generation, which is the elderly people matter. Giving them dignity at the end of their life matters, and you can have a really big role in that if you do these particular skills and training and you're well remunerated and you feel good about your contribution. I think it's really complex, but I think we need to do something fast.
Samara, can I just turn to you perhaps finally on this one? Tourism, I suppose, has come to a grinding halt, look at your face, in Cairns. Describe to me what that has meant for people your age, for your friends and community.
Means nothing. Like we don't go anywhere. You know, there's a big loss in jobs for young people. You know, we talk about these are those positions and places where young people can get entry-level jobs into. You know, that help to give them the kickstart, get money in their pocket, and you know, enable them to sort of start thinking about their career paths. Often it's about, yes, we just need that first win for a job to go, yep, I'm figuring out where I want to go and what I want to do with my life. But I mean, with Corona and tourism, hey, it's been a big challenge, especially for a town like ours, which majority of our workforce, you know, is tourism.
So, Richard, how do you deal with that then? If you've got all these job creation programs, people who have skills in tourism, maybe they've got vocational qualifications, maybe they've got university qualifications, how do they make a choice? And who directs them where they need to go and creates pipelines?
Well, yeah, look, great question. And the answer is, over the last 30 years, the last 20 years, no one. So once upon a time, you know, we had things like Centrelink. I was unemployed in the 1991 recession, worst period of my life. Came out of uni, couldn't get a job. In the olden days, when you registered for unemployment benefits, there was also the Commonwealth Employment Service. And the Commonwealth Employment Service helped to match you to jobs. It helped to match you to training. And once upon a time, this was very much a role for government. Now, over the last 20 years, we've told ourselves, oh, we're going to privatise this and deregulate that. And it just hasn't worked. And we've had scam after scam. We've had tens of thousands of people training to be physical trainers, not because there were jobs for them, but because it was cheap and fun to set up a physical training academy. It was very lucrative for the person training the people. It wasn't very lucrative for the people getting the training. We've seen enormous stock market collapses of listed companies where people have been making billions providing effectively dodgy training that turned out to be worthless to the people who got trained and to the taxpayer who paid it. The system isn't working, it's not working. The old-fashioned TAFE system, the old-fashioned Commonwealth Employment Service, was far more efficient and far more effective and far cheaper than this convoluted gobbledygook we've invented that actually tells young people, give me $10,000 and I'll train you up to do something. It sounds good, it's in my interest to sell it to them and make it seem sexy and make it seem like a good idea. If they never get a job, it doesn't affect how much money I make, it's a rip-off.
I think we're going to be having a discussion about jobs and workforce planning perhaps for the next 10 years. It's really important. Thanks so much for being part of it, Richard. Richard Dennis, Chief Economist of the Australia Institute.